Hello, my name is Rick Olderman, and I'm a physical therapist, and I want to talk to you today about trigeminal neuralgia and why you might still have pain if you haven't solved it. So hopefully I'll provide you some clues of where to look that you haven't looked before and your doctors haven't looked before. So let's get started. So the trigeminal nerve is a cranial nerve number 5, up in the brain, feeding this part of the face. The symptoms are usually on one side of the face. There's a primary trigeminal neuralgia caused by compression of the trigeminal nerve by an artery or vein. And then there's secondary trigeminal neuralgia caused by other compression of the trigeminal nerve like a cyst or tumor. Now, in my research on this, I found one website that identifies 7 types of trigeminal neuralgia. So you can go down as deep into the rabbit hole as you want to split apart all the potential different causes or contributing factors to trigeminal neuralgia, if you like. I found this to be a really interesting and informative article if you're looking for one source of a comprehensive overview of trigeminal neuralgia. It's in Current Neuropharmacology in 2020. There's the journal. Go ahead and look that up if you're just beginning on your search, or even if you've had it for a while and think you know a lot about it. This might clear up a few things for you and bring out some details. Now, there's a popular surgery for trigeminal neuralgia. If you go to this YouTube link, you can watch the surgery, a surgery on trigeminal neuralgia. Warning, it's a bit graphic, as you can see from this image. However, I find it fascinating. You might find it fascinating too. Trigeminal neuralgia is often blamed on arterial compression of the trigeminal nerve in the brain. However, there are many studies that are showing that this may not always be the case. These show that many people have arterial compression of the trigeminal nerve and have no trigeminal neuralgia symptoms at all. I even found studies that show arterial compression on the opposite side of the trigeminal nerve than where the face pain is. While arterial compression may be a cause, it may not be the only cause. And I have a little theory about this. What might be another cause of the trigeminal nerve? Well, in order to answer that, it's important to understand that the trigeminal nerve has a nucleus. And you can think of the nucleus as an egg yolk, all right, which is kind of like the center of the cell body of the nerve. Trigeminal nerve has 3 different nuclei. And one of those, the subnucleus caudalis, extends all the way down into the neck region, into C2 and C3. This controls pain and temperature. And this is how I think I've helped the few people that I have helped. I think this is why I've helped them, is because they had irritation of the subnucleus caudalis in the cervical area. And by treating this area, their trigeminal neuralgia symptoms went away. How did I treat them? What would be causing the subnucleus caudalis to become irritated in the neck region? To answer that, you have to understand how I look at almost all chronic head and neck pain is due to the shoulder blade, because there are significant attachments from the shoulder blade or the scapula into the base of the skull and all the vertebrae traveling down the spine. So it is a huge influencer of what's going on in this cervical and head region. Deep to this big muscle, this trapezius here, you'll see a levator scapula muscle, all right? That goes into C1, 2, 3, and 4. And if you remember, the subnucleus caudalis goes to C3. It's in the area of the insertion of the levator scapula. My treatment of fixing shoulder girdle and shoulder blade problems, what it does is it's unloading the levator scapula strain to the neck and the base of the skull. This is why treating the shoulder blade solves chronic migraines, regular tension headaches, chronic neck pain, whatever. It's my go-to treatment to solve all chronic head and neck pain, and it works really well. Well, I've only had a few trigeminal nerve patients, but it's also helped them as well. And this is the mechanism by which I believe that is helping. For those of you who are finding this information useful and helpful, I would ask that you please subscribe, like, and most importantly, share this video with others
who are suffering from neck pain and headaches. This is likely what everyone is missing that's causing their chronic neck pain and headaches, including radicular symptoms down the arm.
When I first wrote my neck pain book, this was the very first testimonial someone emailed me after I published that. And I'm going to read it here. I am so glad I ordered your book. After 2.5 years of severe pain on the left side of my head, around my left eye, and a weird extreme feeling of discomfort deep in my nose, a symptom I have not yet come across despite all my research, doctor's visits, etc. And I just want to show you, this corresponds to the branches of the trigeminal nerve: orbital area, sinus area, jaw area. I read your book, did all fours rocking stretches numerous times just this past Wednesday, and the hand on the head position, and now Saturday. I am on day 4 of living pain-free. You have literally given me my life back. I had, in the fall of 2007, been on 3 antibiotics for what was assumed to be a sinus infection, then a negative sinus CT, visit to an ENT, which included scoping up my nose, CT of my brain, an MRI and MRA of my brain, an MRI of my neck, on to a neurologist who insisted I had migraines, despite my telling her it was not a headache I had, but head pain. There is a difference. Physical therapy appointments, which caused increased pain due to aggressive massaging of trigger points, many chiropractic visits, which did offer some relief, 4 months of yoga and acupuncture, which brings me to December of 2009. I was just this past Monday suffering from depression and despair, thinking this would be the rest of my life. I am 52 years old, and before this in great health. Yours was the 4th book I have purchased on neck pain, but the only one that even mentioned the scapula and shoulder as being a probable cause. My husband is so happy I have found an answer that he has literally mentioned flying me to Colorado to be seen by you. She had significant symptoms. What perplexes me is this all sounds like classic trigeminal nerve pain. However, it was not diagnosed as trigeminal nerve pain. But however, this was back in early 2000s, and I'm not sure if they really had this idea of arterial compression of the trigeminal nerve back then. Anyway, all of her symptoms relate to all of these branches of the trigeminal nerve. And if you're having weird face pain, this may be one of the things you have, and you should have that checked out by your neurologist, if you haven't already done so, to confirm whatever may be going on here. As I mentioned, there are secondary trigeminal neuralgia, which can be caused by other compression of the trigeminal nerve. So perhaps you have one of these other issues secondarily compressing the trigeminal nerve, and your neurologist or doctor can identify those sources of compression. However, if none of that is happening and you're struggling with pain, I think this would be worth a try.
For those of you interested, I've created digital home programs to solve chronic pain, including neck pain, headaches, and shoulder pain, that I think will help you quite a bit. You can find those at www.rickolderman.com. I strongly encourage you to join my free masterclass, which has a link below, and I'll take you through tests to help you understand why you're having pain and develop a program to solve it. I hope to see you there.